Hi everyone, I'm Sarah Bertuccio, a senior double majoring in biological sciences and psychology on a pre-med track.
Hi guys, I'm Mike Brennan. I am a senior cell molecular biology major, focusing biochemistry, also in the pre-med track.
Hi, and my name is Lila Burley. I'm also a senior. I'm majoring in cell and molecular bio with a focus in biochemistry, also on the pre-med track. And today we have Bill Law here at Geisel School of Medicine at Dartmouth College. He's a fourth-year med student, and he's going to answer a few questions for us.
Sounds good.
So what factors influenced your decision to pursue medicine?
I guess I'm not one of the people that has like some grandiose story about like what happened in my life. I just, I think it kind of connects all the things that I enjoy. So connecting the science and the research and obviously like serving the community and helping people, even though they tell you not to say that, which I don't really understand. And I think all those things together were important to me, and I found it that I could do it in medicine.
All right, and what specialty are you leaning towards, if you have one that you are leaning towards, and what aspects in your medical school experience have shaped that so far?
Yeah, so I'm definitely leaning because I'm a fourth year, and so we're applying to residency right now, and so I don't have much of a choice but to lean. And
Right.
I'm going to be doing general surgery as my residency, and then you can do general surgery after residency, but you can also do a fellowship. And the things that you can do from general surgery are pediatric surgery, trauma surgery, vascular surgery, surgical oncology. There's a few more that I haven't said yet, but there's a bunch of different options. I guess you asked what factors influenced it. So I don't have any family in medicine or anyone that I know really. And all the things that I thought were just kind of what I had heard. And I had heard surgeons were pretty mean and worked ridiculous hours and that I wouldn't want to do it. And I'd say that some of that is true. They definitely do work ridiculous hours. But I think that the ones that I've interacted with haven't been as mean as I had heard. In fact, some of them were some of the nicest and smartest doctors in the hospital, in my opinion. And I think as a result, I felt like I could consider surgery as an option. And I think it's a really cool specialty because you can combine a bunch of different things. You can combine teaching people about their disease, just like a lot of the other doctors would do, but then you also get to obviously go to the operating room and actually fix things or try to fix things. And then afterwards, you take care of really complicated patients, which not every specialty does in an acute setting. So I think those are the things that I enjoyed. Also, you guys didn't mention it. I graduated in 2015 and I majored in biological sciences and Spanish as my majors. It's kind of funny. You guys all were like, oh yeah, cell and molecular bio. I wish I had like even known about cell and molecular bio when I started. I just did bio. I basically took all the courses that you guys take and then like probably should have switched my major, but no one really told me to do that. So I didn't.
Well, thank you so much. Actually, our next question is going to be more about your time at URI, so that's like perfect.
And that.
Yeah, so if you could like provide advice to a URI student about any specific experience or their application to medical school, what would you say?
I think this is a hard question because the cliche answer is like, oh, just do what you like. And I do agree with some aspects of that. Like you should do things that you enjoy and try not to waste your time doing a bunch of things just for an application. But on the other hand, obviously you have to do certain things. I think some of the things that I would say are you should try to get involved in research at school. It was hard when I was there because there weren't a lot of people doing health, like basic science related to healthcare. But I think the pharmacy program has gotten a lot bigger and the neuroscience program, and there's probably more opportunities. but you have to be prepared for a bunch of people to say no to you asking. So I think that's one thing that I'd recommend. Just do what you like, but keep in mind that there are certain things that you have to do, and maybe you'll like them more than you anticipate once you try them.
Are there any courses or experiences that you had that would be available to URI students that you would specifically recommend for pre-medical students?
Yeah, I think things have been changing a lot, so I'm not totally sure what all is still available, but I think one of the things that I enjoyed were the honors courses that I took, and I actually like TA'd one of the honors courses on emerging infectious disease with Dr. LeBrun, but I'm pretty sure he's gone now. But I would say like any of those type of courses would probably be super enjoyable for people. And then I also did a lot of stuff with URI Saves and the ambulance, and I would say that both of those things were like pretty meaningful to me. I'm from Southern Rhode Island, so it was cool to do service activities in the area that I grew up and just like see it from a different perspective. But anyone that's from Rhode Island, I think that applies not just for me. And then the ambulance, I think a lot of people do it, and I would say that that's something that you should really try to do is work on an ambulance or work in a medical office, or obviously you need hours to go to medical school or PA school, but I feel like doing that early on is important because then you get to feel if you actually like it or not. Then there's other opportunities, like most people I think do the URI ambulance just because it's close and easier to access for people, but I think that if you early on go to EMT school like in the summer or try to fit it in somehow, then you can do other things and actually provide the patient care a little bit more and like work on rather than just like a basic life support ambulance, you could work on one with paramedics and you can kind of learn different things, which I ended up doing. And I would say that that's something you should try to do. I know they teach the EMT course at URI now, but they didn't do that when I started. So I had to like commute to North Providence and all this stuff.
All right, and thank you so much for sharing all of that. And just in this last question, I just want to give you the opportunity, if there's anything else that you want to share about your time as a pre-medical student or a medical student that you think is beneficial to us and the rest of the pre-med kids now, we'd love to hear it.
This is when I'm supposed to give all the sage advice that I don't have. I guess one thing I'd say is that it's kind of funny that you guys, or that Dr. Simmons even asked me to like do things like this, because I remember when I was an undergrad, which is not that long ago, there would be med students or seniors that would like come and talk about their experiences at URI and in med school. And I was like, wow, these people are like geniuses. I'm never going to be like that. Like maybe I'll get into med school, but even then I'm not going to be like that. And then now I'm being asked to do these things, which is kind of like fascinating to me. And then the people that talked at these types of events or interviews when I was in school, then I like am friends with them online on, I like follow them on Twitter and stuff, and I see them and they're attending doctors at like some of the, like the craziest places, like, and by crazy, I mean like the best places in the country. And then you just don't really anticipate it. And then it just happens. So I'd say that that's just kind of like a perspective thing, which I think everyone will get no matter what they end up doing. Another thing that I would say, I feel like you'll get a lot of no's in terms of whether you're asking someone to shadow or you're trying to do a research project and there's no room in the lab, or you apply for like a job or a like research position and they say no. And like I've gotten so many of those and you still can do what you want and get where you want to go. So it's hard not to let it discourage you and to like keep too big of a chip on your shoulder. You can keep a little chip on your shoulder, but I feel like at some point you have to like just keep going. And that was important to me. I guess one other thing I'd say is you can aim bigger than you think you can aim. So when I was in school, I did like 1 year of research in a lab. I did like mostly a volunteer thing. And my PI, Dr. Camberg, she's cell molecular bio, she was like, oh, you should apply to the NIH post-bac. And when I applied, there was like 1 or maybe 2 people from URI that had gone to the NIH to do anything after school. that I know of. And I was like, first of all, I've done minimal research. Second of all, no one goes to the NIH from URI. And then she was like, oh, you should apply. And so I applied, and then ended up getting to go there and do research in like a fantastic lab and learn a ton of things. And then it just opens so many doors to you because you connect with all these other people that you wouldn't normally connect with. And I think that the message there is like, don't doubt that you can actually get into certain things, and just try. So that's what I would say for my advice.